You're listening to Happier Healthier, a podcast presented by Conway Medical Center. In each episode, we bring you expert conversations and actionable strategies to help you navigate your health and well-being, fostering a happier, healthier life for yourself and your loved one. This podcast is made possible by the CMC Foundation. Their impact in our community is truly transformative. Think about this. Since 2005, the CMC Foundation has funded over $700,000 in mammograms for underserved individuals. They've invested over $200,000 in scholarships for CMC employees continuing education over the last decade, directly strengthening our healthcare workforce. And through the CMC Smart Snacks program, they've supplied over $559,000 in provisions to Horry County children. The foundation also provides crucial support like over $8,000 for cancer patient transportation. These are just a few examples of how they actively enhance the health and quality of life for individuals in our community. Hello and welcome back to Happier Healthier. If you have ever wondered about persistent shoulder pain, how to tell if it's arthritis, or what your treatment options are, you are in the right place. We are joined by Dr. Phillip Sussman with CMC Orthopaedics to talk all about living with shoulder arthritis. So thank you, Dr. Sussman, for joining us and welcome to the show. Just to start, for those listening who might be experiencing shoulder discomfort, how would you kind of describe shoulder arthritis?
So a lot of times there's various types of shoulder arthritis. A patient who may have had shoulder pain off and on for many years could have started developing rotator cuff tear, which then became a large rotator cuff tear. Over time, if you have a chronic massive rotator cuff tear, the humeral head can start to migrate superiorly in relation to the socket, and you can develop what we call rotator cuff arthropathy, which is just arthritis from a large chronic rotator cuff tear. Then you also have just primary shoulder arthritis just from wear and tear over the years. That one's more of a central wear where the socket, the ball kind of just roads directly into the socket. But that one's just normal wear and tear, like treads on a tire. The more miles you go, the more the treads wear. So, and then you also have various things like rheumatoid arthritis, which can cause arthritis on its own. That's typically starts off more as a soft tissue disease and an autoimmune disorder, which then progresses to affect the cartilage and starts to wear it away that way. So, regardless of the arthritis, typically, at some point when it's bad enough, then you can get a shoulder replacement.
And so what are some of the symptoms? Is it just pain, or how can people identify that this is specifically arthritis?
Yeah, so a lot of times patients will notice they've had pain off and on over the years. Typically, it's more of like a throbbing, aching pain the more people do throughout the day. So if they do a lot of lifting, they'll notice it can throb at nighttime. It can wake you up at night when you lay on that side. Um, Other things that you can notice, the worse the arthritis gets over the years, you can notice that certain motions like going behind your back or reaching back this way, you can start to notice that those motions, you can't get as far as you used to. That's typically more of a chronic process. So a lot of times you may not notice it because it's a slow change over time. But usually like internal and external rotation, where you're going back like this or behind your back, are affected more often than raising your shoulder. I've seen patients with really bad arthritis where they can still get their arm up. Um, but yeah, that's pretty much it.
Are there certain things that cause it? I mean, I can imagine that looks like swimming. If you do those motions more, are you more prone?
I would say, swimming, pull exercises, I will say, are great for all your joints in your body. I will say it typically will happen more like weightlifters who have been lifting a lot of weight their whole life. They like bench pressing, they love push-ups. That puts a lot of stress through the shoulder. So those patients can actually develop arthritis earlier in life. But also too, there's a small component of genetics in it as well. But it can just be wear and tear, I've seen a lot of like laborers, farm workers who have been doing a lot of farm work over the years, who just from wear and tear, you develop it. So I will say it's somewhat more related to a lot of heavy lifting over the years, but it can just occur naturally as well.
Is it a common misunderstanding with arthritis? People think that you just kind of live with it, that it there aren't really treatment options.
No, that I mean, we have a couple different treatment options. Obviously, I think strengthening the shoulder can be very important. When you start getting pain in the shoulder, it can throw off the mechanics of both your shoulder, your ball and socket joint, and then also the scapula, how it moves on the back of your ribs. So that can affect you in a negative way as far as range of motion. So really working on range of motion, strengthening the shoulder can be helpful on its own. Um, it won't affect the bony blocks as far as like if you have osteophytes that prevent you from getting your arm back like this. It may not help with that, but it can help with the pain and your function on everyday activities. The other thing that typically can help is like anti-inflammatories. We also have things like cortisone injections that we can inject into the joint to help calm things down. This is typically a long-term process or a chronic process, and you can have acute flare-up. So if you were doing a lot, it can kind of start a fire in the joint. And really, the goal is to try to calm that fire down to get you back to doing what you were doing prior. Again, it's not like arthritis just popped up over the weekend. You did something specific that flared things up, started a fire in the shoulder. And my goal as an orthopedic surgeon initially, if you've never had treatment, is to help calm that fire down, see if we can get you back to doing what you want to do. Um, and then over time, when those things don't work, then we start to consider, is shoulder placement the right option for you?
Okay, so if a patient feels like they have shoulder arthritis and they come to see you, what can they expect with that consultation? Will there be an MRI? Kind of what does that all look like?
Yeah, a lot of times I don't necessarily need an MRI for shoulder arthritis. A lot of times I can diagnose it with the X-rays. I have various views that I can look at and can tell me, whether it's related to a chronic rotator cuff tear or just good old, basic arthritis. A lot of times I don't have to get an MRI for it unless I'm concerned about the rotator cuff and it can affect the type of implant that I use for surgery. But typically it involves X-rays. A lot of times, if you've never taken any anti-inflammatories and you are able to, I'll start you on anti-inflammatories, and then typically we'll give you an injection into the shoulder joint to see if we can get things to calm down.
Okay, and I know you specialize in shoulder preservation surgery, so
Mhm.
can you first tell me a little bit about that?
Yeah, so I think when you talk about shoulder preservation, there's not a ton you can do when the joint is completely worn out. We can't regrow cartilage. We can't. There are certain things we can do with a camera and scope. If someone is younger and wants to avoid a shoulder replacement, we can actually go in with a camera and scope. And there's these little osteophytes that grow off the bottom of the ball, which we can actually smooth those out to help with range of motion. It doesn't get rid of the arthritis. It's more of a temporizing procedure to see if you can get some relief. But really, where I think the shoulder preservation comes in is, if a patient is younger or, they're still, 50s, 60s, and they are active, and they just started having shoulder pain, certainly trying to catch patients who might have a rotator cuff tear early when they have no arthritic changes, and fixing the rotator cuff can be helpful as far as preventing arthritis in the future. Now, with any procedure we do on the shoulder, whether it's a camera scope, anything like that, that does increase your risk of development of arthritis. But it's one of those things. If we can fix a big rotator cuff tear, that can prevent the progression to one of the causes of the arthritis, like rotator cuff arthropathy.
Interesting. This might be a stupid question, but if somebody has a torn rotator cuff, do they always feel those arthritic symptoms?
No, there's a couple different types of rotator cuff tears. There's acute rotator cuff tears, and then there's chronic degenerative rotator cuff tears. I will see a lot of patients that I see in clinic who are in their 50s, 60s, or older. They suffer from degenerative tears. And how I describe that is just like a rubber band that you leave in the garage for many years. Well, the elasticity of the rubber band isn't as good anymore. So you get cracking in the rubber band, and it just doesn't stretch quite as well as it used to. So what you can actually get is tearing in the rotator cuff, and over time, just working, that rotator cuff can eventually turn into a full, tear. And it's trying to catch those symptoms, earlier on. Now, it doesn't necessarily mean you need surgery. It certainly treating patients who have degenerative tears with conservative things like therapy, anti-inflammatories can be hugely beneficial as well. And then you have acute rotator cuff tears where someone was lifting something heavy, they felt a pop in their shoulder, and typically those patients won't be able to lift their shoulder. They have to use their other hand to kind of lift the shoulder up. Those are more acute tears, and typically we're a little bit more aggressive in those because we know that typically the tendon quality is better. Um, Now, those typically will happen in younger patients, not always, but it's usually patients under the age of 50 that can happen in.
For those who want to kind of manage their pain and think that maybe they're not candidates yet for any of the more severe treatments, what can they do? What are some kind of lifestyle tips?
So certainly weight can, if losing weight and also strengthening the shoulders can be hugely beneficial. But also too, over-the-counter anti-inflammatories can be helpful, especially if you start to feel that it kind of the aching pain is coming on. Getting yourself on a little regimen or anti-inflammatories to help prevent that flare up from kind of getting out of control can be an option. And then obviously we have the formal therapy, and then also the cortisone injections, which can calm things down.
Do you like Voltaren gel?
Um, yes, I do. Now, I will say typically Voltaren gel works better on like the hands and feet. I have had some patients who use it on the shoulder. The thing with Voltaren gel, it's absorbed through the skin. So the structures that are deeper doesn't always kind of hit those structures. That's why it works really well on the hands and the feet because everything's close to the skin. But I'm not saying some patients don't benefit from it. There's certainly patients who may not be able to take oral anti-inflammatories. Even though some of it's absorbed systemically, it's not as much as like taking by mouth, or people who might be concerned by about taking oral anti-inflammatories. It can be helpful in those cases.
Okay. And what about for the worst case scenario if they, well, I guess not worst case scenario, but the more severe case scenario where they would need shoulder replacement surgery, how will that kind of change their lives afterwards?
Yeah. So I will say the big thing I preach with patients is shoulder replacement surgery isn't done for range of motion. So I will say, when it gets really bad, there are patients who can't even reach the back of their head. In those cases, a lot of times patients will have significant increase in their range of motion. But shoulder surgery itself can decrease range of motion. So if someone's straight up like this, they might not be able to get all the way up. I have had patients who are have great range of motion, but it's one of those things. It can vary from patient to patient. But I think the main purpose of a shoulder replacement surgery is for pain. So patients who where it wakes them up at night, it's their dominant arm. They can't cook, they can't eat, they can't brush their hair, they can't. It's just a struggle to get through the day. Those patients will typically do the best as far as getting a shoulder replacement because once we get rid of the arthritis, the pain, it's a different type of pain, like surgical pain you have afterwards. But patients, you get that deep ache that just throbs and kills you throughout the day. That pretty much goes away.
And how long is that recovery process?
Yep. So typically, it kind of depends. I will say patients who had the arthritis in the non-dominant, so I'm right-handed, you don't kind of feel the effects of it as much because you have your dominant arm, you can get around, you can eat, you're just used to using your dominant arm more. Um, when it's your dominant arm, it can be affect you a little bit more. Typically, you're in a sling for about 6 weeks, but I have you coming out of the sling to work on range of motion pretty much immediately after surgery. You can pick up small things like for eating, cell phone usage, things like that. As far as like driving, more if it's in your dominant arm, really, I want patients to kind of have some strength back, or at least kind of out of the sling, especially if it's their dominant arm before they drive. But that can kind of, vary. So usually about 4 to 6 weeks before driving. But overall, like as far as eating basic stuff, you can do that. It's using the sling to protect the implants for the first 6 weeks. And then after the 6 weeks, we wean you out of the sling, just continue therapy, working on range of motion and working on strengthening. And it just kind of goes from there. I will say, I typically will tell patients about a 3 month recovery as far as range of motion, feeling like your strength's doing well. It's usually about a 3 month recovery.
3 months is not bad compared
Yeah.
to going your whole life with
Yeah.
pain.
Yeah, exactly. So I will say a lot of patients are by 3 months, they're very happy. You're out of the sling. So the first 6 weeks can be the most. I would say restrictive, but that's where we're protecting the implants and just kind of working on range of motion. Everything's just gentle for the first 6 weeks. We let the inflammation calm down, and then when things are feeling better, then we really start to work in therapy.
If somebody is kind of thinking maybe they want to get their shoulder checked out, they have pain, what are your walk-in hours? Do you want to kind of plug your availability?
Sure. So there's three different offices that I go to. So twice a month I'm in Socastee. I do accept walk-ins every week of the month on Mondays down in Socastee. You can just you can call the office there. They can get you in. And then on Wednesdays I'm in the Grand Dunes location, and I accept walk-ins during my normal office hours. And then I'm also at Grand Dunes on Fridays. And then Thursdays, I'm here in the Conway main office seeing patients. So pretty much if I have office hours, I'll take walk-ins.
Great. I'll put
Yeah,
all of that in the episode show notes.
perfect.
Awesome. Dr. Sussman, thank you for doing this.
No problem. Thank you.
That's it for this episode of Happier Healthier. We appreciate you tuning in and hope you gained valuable insights for your health journey. Again, thank you to our sponsor, the CMC Foundation, for allowing us to bring you this information from experts for free. Discover more about the CMC Foundation's vital work in our community and how you can contribute to their mission by visiting cmcfoundationsc.com. That's cmcfoundationsc.com, or find the link in our show notes. And just as a reminder, all content discussed on CMC's Happier Healthier podcast are the individual opinions of our hosts and guests and should not be construed as personalized medical advice. By listening to this podcast, you agree not to use this podcast to treat any medical condition for either yourself or others. Consult your own physician for any medical issues you may be having. This disclaimer applies to any guest or contributor to the podcast. Be sure to subscribe so you don't miss our next episode of Happier Healthier, proudly brought to you by Conway Medical Center.